Congratulations on the birth of your new baby. We would like to take this opportunity to tell you about a research study that is available to extend your baby's newborn screening without any additional burden to you or your baby. Please watch this brief video which explains the process, and a research coordinator will come by to answer any questions that you might have. When a baby is born in New York State, he or she is routinely tested for many different health problems that can be treated early before symptoms appear. This is called newborn screening. Newborns that have these health problems benefit from starting treatment as early as possible. Newborn screening is done on a blood sample from your baby when your baby is about 24 to 48 hours old. A nurse collects a few drops of blood from your baby's heel and places the blood on a special piece of paper. Duchenne muscular dystrophy, or Duchenne, is the most common form of muscular dystrophy, and it typically affects boys. In this research study, we are adding Duchenne to the list of diseases detected by newborn screening. Babies who have Duchenne appear normal at birth, but as they grow and develop, they begin to show signs of muscular weakness. Most boys with Duchenne will need to use a wheelchair by 10 to 12 years of age. Their lung and heart muscles are also affected, and this results in a shortened lifespan for boys with Duchenne. There is currently no cure for Duchenne. We think it is important to detect Duchenne as early as possible because there are treatments such as medications and therapies that can be helpful. There are also other promising treatments being developed. Children diagnosed with Duchenne very early may be able to participate in research studies and clinical trials of possible new treatments. Duchenne is caused by a gene change or mutation. It is a genetic condition, but it is not always inherited. In fact, in over 1/3 of children with Duchenne, there is no family history of this condition. There are 3 types of possible results. The first is negative for Duchenne screening, meaning your baby is most probably not affected by Duchenne. The second is borderline for Duchenne screening, and therefore an additional blood spot is needed for retesting for Duchenne. The third is positive for Duchenne screening, meaning that your baby is likely to have Duchenne and needs additional diagnostic testing to be performed. A second specimen will be collected from your baby and sent to a laboratory that has experience in looking for changes in the gene that causes Duchenne. The initial screening for Duchenne can be done with the blood already collected from your baby for the standard newborn screening test. If the results of the Duchenne test is positive, then an additional specimen will be needed from your baby to perform a more in-depth diagnostic test. Because Duchenne screening is not yet routinely included in our newborn screening panel, a separate consent form must be signed by one of the parents. This form gives us permission to do the new Duchenne-specific screening for your baby. Results of the initial Duchenne test take about 2 weeks. Similar to all negative newborn screening results, a negative Duchenne result will be reported to your pediatrician and hospital of birth. You should discuss your baby's results with your pediatrician at your next well baby visit. If the Duchenne screening results indicate your baby is affected with Duchenne, you will be notified by a doctor or genetic counselor from our hospital by phone and mail. A genetic counselor is a specialist who will explain the results of your baby's test to you and what they mean for your new baby and the rest of your family. If we suspect that your baby has Duchenne or another neuromuscular disease, you will be asked to bring your baby to the hospital to be examined by a team of specialists. While the screen is looking for Duchenne, it is possible that we may find your baby to have a different type of muscular dystrophy. In some cases, we may not be able to identify a specific diagnosis for your baby. Because Duchenne most frequently affects boys, if a baby girl screens positive, this may indicate that she is a carrier of Duchenne. Carriers of Duchenne usually do not have symptoms of Duchenne, but are at risk to have sons affected with Duchenne when they grow up and start a family. Some women who are carriers of Duchenne develop a weakened heart muscle in adulthood. Therefore, we recommend that women who are carriers of Duchenne be evaluated by a cardiologist at 40 years old. Knowing that your baby might develop symptoms of Duchenne or other types of muscular dystrophy may make some parents anxious, and this is the main downside of receiving these results on your baby. In some cases, we may not be able to identify a specific diagnosis for your baby. The uncertainty about your baby's health may make you feel uncomfortable. If you decide to have your baby screened for Duchenne muscular dystrophy, a coordinator will have you sign a consent form giving permission. If you decide not to have your baby screened for Duchenne muscular dystrophy, that is fine. Your baby will simply have the routine newborn screening. Congratulations again on the birth of your new baby.